Now we'll look at another infection which could affect the musculoskeletal system. This is what is known as what? Maduromycosis. Maduromycosis. So you can see how it affects, the leg so much. All right. Maduromycosis. So for Maduromycosis, it's also known as what? Madura foot or mycetoma. It's a chronic progressive what infection of the skin and the underlying tissues, usually to affect the feet. So it's caused by what? Either the fungi known as what? mycetoma or filamentous bacteria known as what? Actinomycetoma. So origin of name, it was first described in what? Madurai, India in the 1840s. So it could be caused by fungi Madurella mycetomatis or Madurella grisea. Can also be caused by bacteria known as what? Nocardia brasiliensis or Actinomadura or streptomyces. So usually enters the skin through wounds or trauma. All right. So usually occurs when people are walking barefooted and all of that. So you can find it in Asia, in Africa, South America. So clinical features. Early on, you see a painless subcutaneous nodules of the foot and leg. Progression. The nodules enlarge and form a sinus tract where you now see that pus is draining out of that site. So chronic granulomatous inflammation leads to swelling, deformity, and bone involvement. Late stage, there's severe disability and there's disfigurement. Sometimes amputation will be needed because that limb will kind of like be completely damaged. Clinical features is there's painless subcutaneous nodules on the foot or leg. Progression. The nodules enlarge and form sinus tracts that discharge pus containing grains. Alright, the causative organism will be seen in those grains. So diagnosis is what? Chronic swelling with draining sinuses. We suspect that. Microscopy will now be able to identify the microorganism there. So imaging too will also show you the bone destruction. So treatment is what? If it's bacteria, you use what? Sulfonamide, amikacin, rifampicin. If it's fungal, you use what? Itraconazole, ketoconazole, and sometimes surgeries where you try to debride the dead tissues. Or you can actually, care for the wound and also physiotherapy.